Welcome back, everybody. Something we can all commit to working on as Mental Health Awareness Month wraps up is breaking down the stigma surrounding the topic. And today, we're going to talk about how harmful those stigmas can be for those who are really seeking help when it comes to their mental health. Joining now virtually is Susan Harrington. She's a marriage and family therapist with Maison V. Susan, so good to see you virtually. Thank you so much for being here. So glad we are talking about this topic. May has been one of my favorite months because we've really been having great conversations in regards to mental health, but we haven't talked about the stigma. What are some of the stigmas around mental health, would you say?
Well, hello, Malik, and it's good to be back on the show. So yes, the stigmas that we have that show up for mental health come across as these beliefs we have about others and the judgments we have around them. And we do that in a variety of ways. You know, we do like race and gender and political status and sexual affection status. We do stigmas in all kinds of ways, and they just result in discrimination and rejection feelings. Now, the Center for Medicare Services came up with 9 myths that are really important for us to have a conversation about.
It's so true, and we actually have something that we want to show you all. I'm so curious, as we talk about these different myths and show people rather, where do you think all of this comes from? Because I hear so many times people say, mental health doesn't affect me. My child doesn't have mental health issues, but that can be false. It's a myth.
Absolutely. So myths are definitely, these beliefs we have, and beliefs that are based in fear. Myths are typically beliefs in fear. And so the CMS services did some research and came up with these 9 myths. What's really true about mental health not affecting me is that 1 in 5 adults have a mental health diagnosis or should be diagnosed with one. So think about how many adults are in your family when you get together for Christmas or Thanksgiving or some holiday, right? There's how many adults? Well, 1 in 5 of them probably have this status of a mental health concern. So it's really important because that's what myths are set up. Another example is it's impossible to prevent, mental health issue from happening. We have actual things we're going to be talking about today, like resilience after a while, that really hints at how we can prevent a mental health diagnosis from happening. And I want to just notice that in order for us to debunk these myths, we have to gain knowledge. And I have facts that are set up on the website, on our Learn page and our video page, that just detail all the facts that debunk these myths.
It's so important that we debunk these myths. And I want to talk a little bit more about stigma, right? And where stigma comes from. It really can be a cycle.
Oh, it absolutely is. So stigmas show up personally, they show up publicly, and they show up systemically. But actually, how they show up is in these 3 dimensions. So it could be in our knowledge, right? We're having myth as opposed to fact. It could show up in our attitude. We have negative as opposed to open-minded. And our behaviors, they could come across as harmful as opposed to being helpful. So for example, knowledge is a prejudice and an assumption that happens. If when we get the facts, like we talked about with the myths, then we're more likely to not be stigmatizing someone. In 2019, the APA did a study and found out our attitudes are really a deeper issue. We're going to not date someone. We're going to be afraid of someone, and we'd even change our attitude negatively of someone. More than almost half of us in America would do this once we know someone has a mental health issue.
It's so important that we're talking about this because, yes, even though we're towards the end of May now, this is a conversation that we can have all year long, not just about mental health, but really any stigma, like you mentioned, when it comes to race, sexual orientation, gender. So very powerful that you mentioned those 3 different dimensions. When it comes to breaking this cycle, right, because stigmas can be a cycle, how do we break that mental health stigma?
So we have to form something to address the knowledge, attitude, and behavior pieces that are based in these myths. We have to get the facts. So what are they? That's so important for us as Americans. We believe our head is where knowledge is, right? Knowledge is power. And so we want to get the facts and adjust our attitude and then address our behaviors. So first, we make a clear call for action. With the 3 steps that are listed below are that plan. So determine your clear access to resources. New Orleans has 3 great access to resources. That's the VIA link. You can look all these up, VIA link. We have a COPE line for each area of our state, so look up the one nearest you. We have the 988 National Suicide Hotline. Those are clear accesses to resources. Knowing what the warning signs are of distress. The basic one for every one of our mental health diagnoses is, did the person's behavior change? Are they all of a sudden eating differently, sleeping differently, interacting interpersonally differently? If you see these things, there is some warning sign. And finally, use a different type of language. Notice I'm not saying the mentally ill. I'm saying people with a mental health concern. Our language is where the judgment and the prejudice shines most.
I really appreciate that. And honestly, I'm listening to you, and hopefully everybody else is listening, because it really sounds like it starts with a conversation with ourselves. Are we seeing ourselves change? And look for that in your family members and your loved ones as well, because yes, even though we are wrapping up Mental Health Awareness Month, this is a conversation that will last all year long. Susan, thank you so much for being here, and don't move because we've got more to talk about. Look, if you want help with your own mental health, you can contact Susan. To learn more about her teletherapy services, just log on to MaisonVLA.com or call the number on your screen. Now, coming up next, we're going to talk about building resilience when it comes to your mental health. Like I mentioned, Susan is sticking around. Don't move.